When you're working with families from a variety of cultures, what kind of an approach do you use to show that you're open to understanding about their culture and to help them open up to you?
I listen, and then I think in the beginning I try to see where they're coming from, what are their concerns, and I try to give them some time to tell their story. And while they're doing this, so it helps me to understand, what their perspective is, what their expectation is, what doors they've knocked before. So what I would suggest that pediatricians do to really have a sense of what the families are coming from is to really follow what the American Academy of Pediatrics is recommending, which is not only the screening, but they recommend something more important, which is surveillance at every well-child visit. And what surveillance really is asking open-ended questions to the families, irrespective of where they're coming from, the cultures, their background. Do you have any concerns about your child today?
Well, I think there's so much that happens, over the course of our evaluation, and I try actually from the beginning to let them know what we're doing, what we're looking for. So often I will say at the first visit, some of the things that you've described to me can be consistent with a diagnosis of autism. Have you ever heard that term? Has anybody ever used that term to describe your child? So I try to start really early on, even before I do the testing, to sort of just lay the groundwork so parents understand what I'm trying to do. And then for when we come down to actually talking about the diagnosis, what I like to do is really get a feel for where the parents are in terms of their understanding, not only of the diagnosis in general, but their understanding of their child's abilities, so that I can then approach them at the same level and kind of lead them to what I want to explain to them.
We're used to having our usual approach towards sleeping or feeding or parenting or behavior that works so well or so much more intuitively with parents who come from our same backgrounds. But sometimes we'll be kind of giving that same spiel to a parent from a different background, and we may recognize that it's just we're not connecting around those issues, and that would be kind of the signal to yourself to stop and say, just ask a very open-ended question of how do you see this behavior in your child? What's the meaning of it to you? What sort of what are the important values that affect the way you parent your child, and what are your goals for your child? And I think those kind of shared goals are what can put pediatricians and parents on the same team, even if their cultural backgrounds or even their opinions about child rearing are very different.
I think cultural competency is a misnomer because every family is a unique culture, even to themselves. So knowing one family, some things might extrapolate to working with other families, but they might not. It's a different family. So ask them who they are, get to know them, let them lead and direct, and if you're confused, just get more information. But I think by building a relationship and showing that you're invested in the family and showing that you're invested in understanding who they are and what they bring to the table really helps form that therapeutic alliance that helps you work with the family and treat the child.